I'm Tom Torlakson, State Assemblyman, here to announce legislation to save the poison control centers of California. And we're right here at the emergency room at Children's Hospital because over 51% of the 300,000 calls we get a year involve a child 5 years or under. The emergency rooms of California, this emergency room is already packed, overcrowded. We have a crisis in terms of how we're going to continue the Poison Control Center of California. Lives have been saved, 900 calls a year, 61,000 visits to emergency rooms avoided because we have one of the most efficient, expert, 24/7 emergency response systems for poison control in the entire world. We're the biggest in the entire world, but because of the budget cuts, the Poison Control Centers of California are facing horrendous cutbacks and extinction by 2010 if we do not get legislation to find a funding source to stabilize their program and continue it into the future. I'm a health teacher by profession. As parents, we know how kids work. There's a lot of experimenting. Kids are naturally curious. They see bright-colored fluids that may look like something they're used to drinking, and we'll find out in a minute what can happen. But young children are taking things in that will kill them or severely damage them. But we have a 24/7 expert crew of medical doctors, of toxicologists who work with parents, who work with caregivers, and save these children's lives and avoid them having to come to this emergency room here in Los Angeles. Dr. Cyrus Rankin will be talking about the details of how the program works, and I'm just here to commend their efforts and to stand by them and say I will work with the legislature to find a permanent funding source that's secure and stable so their good work can continue.
At California Poison Control, we take over 300,000 calls per year, which amounts to almost 900 calls per day. And being the largest poison control center in the world, we are actually also one of the most efficient centers in the world at handling these calls and making sure that we can do our best for these patients and making sure they can stay out of the emergency department as much as possible. We have people who are trained specially in the order of nurses and pharmacists and medical toxicologists and other specialists who are trained specially to handle these calls and be able to talk with parents, talk with patients, and go through their poisoning or overdose or whatever may have occurred at home, in the emergency department, in the inpatient setting, or in critical care wards in our hospitals to make sure that we give the most up-to-date and contemporary management and treatment options for these patients. When you look at our display here, we have a number of products. For example, this is a sports drink which has a nice orange color. This is a floor cleaner which also has a nice orange color. And over 90% of all the poisonings that we tend to hear about at Poison Control occur right in the home. And as a result, we want to make sure that we know that people understand that prevention is always the best key. And at Poison Control, not only do we help treat the patients, but we help prevent the poisonings from happening in the first place. And knowing at home that we all have essentially a chemical factory inside of our homes, whether it's having kitchen cleaners or floor cleaners or any kind of detergent that we use to clean our clothes or clean the objects in our home, knowing full well that we have all these available in our homes and knowing that we need to educate folks about keeping these out of reach of children, out of sight, out of mind. Even with all of this education, even with all the robust outreach that we do, poisonings still do occur, and we are a critical emergency medical service in California, and as a result, we are working very, very hard to try to make sure that we can still provide that service to the community. Thank you. You can always call Poison Control at 1-800-222-1222. You can call that number from any phone in California, whether it's a cell phone, your house phone, or a pay phone, and you will get the Poison Control Center in California, and you'll be able to get that expert advice. 1-800-222-1222. There are a number of problems, and all the problems that you just mentioned are actually have to do with why we see these poisonings occur in homes. When you look at these two bottles, a young child certainly will look at these two bottles and not know the difference, because they're not necessarily going to know that this is for cleaning the floors and that this is necessarily made for drinking. And another problem, however, is the fact that sometimes as adults, when we use these cleaners, we take these products out of the original containers and we place them into other containers, like a juice glass or a bowl, or maybe even another drink bottle such as this. Now it contains a cleaner that can be very, very poisonous. Language barriers can also be an issue as well, that we may have a product in our home that may have a product written in one language, and then the family members might not understand whether it's a cleaner or whether it's a juice at first glance. So they may leave it out, and it may be a cleaner, and a child may come up to it later on and then possibly get into a poisonous situation. So there are any number of factors that can occur, and that's why, like we said before, that all these poisonings that do occur in the home, they are all preventable poisonings, but they still do and still will occur, and that's why this critical medical service is so important. At Poison Control, we get in California approximately 300,000 calls every single year. Over half of those are children under the age of 5. So we treat children at home and when they come to the emergency department and in any other setting. So approximately 150,000 or more of those calls every single year. That's about 450 calls per day that just have to do with children 5 years and under.
And again, that speaks to your point about, do the young children know what they're going to drink or experiment with? They don't even read. So if 150,000 calls a year for young people who don't read, you can see the confusion. So it is a process, as the doctor said, of us as adults keeping the bad products out of reach and making sure the kids can't get to them, but they still do. They're curious and they find ways.
Right, or even
yeah, it may very well have been. You know, any number of factors will come into play, and you look at these two products here, and these are also brightly colored products that sort of match our sports drinks or some of our energy drinks, and these are used to clean our cars and clean our kitchen counters. And so it may very well be that, you know, in our busy days that we have when we're at home with our children and everyone's running around, that an adult may very well take a liquid that looks like a drink and accidentally give it to their children. So that happens all the time, and this is nobody's fault necessarily. We're not here to fault anyone or to try to target anyone in any such way. We just want to make sure that we can try to get the information out there to prevent these from happening in the first place, and when they do happen, to provide the best advice on how to treat them. Some of these the products already have some kind of sticker on them, and that certainly can help us as adults as we try to organize our chemicals and our exposures that might be around our homes. But again, despite the stickers and despite the bad faces sometimes that are on the stickers, children sometimes are even attracted to those more and may actually use that as a reason to go ahead and drink the product. So these measures sometimes can help, but they're never 100%. Coming up this week is National Poison Prevention Week, and during this week we like to go all over the county, and poison centers from all over the country are doing the same thing to try to get the word out about poison control, to make sure people are becoming more aware, more educated, to get our phone number out there. Once again, 1-800-222-1222, that you can call from any phone in any state all over the country to access our services. And it's a absolutely 100% free service to the public, and we are open 7 days a week, 365 days a year, 24 hours a day, always available to give advice and to make sure that we can address these children appropriately, and the adults who get poisoned too, we do the same thing for them as well.